Hey, it's Dr. Kre. Welcome to tonight's edition of the Dr. Kre and Me show. Welcome. Come on in the room. I can't wait to talk to you tonight. We're going to talk about 5 causes of headaches. Yes, 5 causes of headaches. I'm sure here with the weather being the way it has been, hot one minute and cold the next. Hey, Tanya. Hot one minute and cold the next. I'm pretty sure that people have been having some headaches. So tonight, Tanya, we're going to be talking about 5 causes of headaches. 5 things that can be giving you reasons why you could be having a headache. When you get here, make sure to say hello and put your name in the chat, and so we can get started. And Tanya is here from Alabama. Welcome. Welcome to the Dr. Kre and Me show. We're going to get started in about 2 minutes. Yep, 2 minutes. How's you guys' day been? Y'all been having a good day? It's been a good day here. So happy that the days are longer, so the sun is out, and we are just having a good day. Today was tough coming back after Easter. Hope you guys had a great Resurrection Sunday. We had a great Sunday. Zoe did her speech at my dad's church. We got to go down there and get some good southern hospitality. I'm from Marion, Alabama. If you don't know, it is about an hour and a half outside of Birmingham, about 20 minutes away from Selma. It is where Coretta Scott King was from. Adela Childs. Hey, Patrick. Hey, Miss Deborah. So all these awesome women are from there, and so am I. So, we're going to go ahead and get started. You know who I am. I'm Dr. Kre. I am your board-certified family medicine physician, and I specialize in what's important to you through my awesome weekly show. Hey, Jerisha. Through my awesome weekly show, through my awesome practice here in Birmingham, telemedicine practice, my concierge patients. I am here to just help you learn as much as you can about your health so that you can live healthier, happier lives. Hey, Dietrich, I am here to help heal healthcare, and I also help coach wise. I can do them both. I don't want you to think that I'm forgetting about you or neglecting you, because I'm not. I love doing both of them. And here we are. Tonight, this is all about you. And we're going to talk about 5 reasons that you could possibly be having a headache. So when you get here, say hey to me and put where you're watching from. Megan said I have headaches almost daily, so I definitely need to be watching this. Yes, you do. Hey, Jerisha. Hey, Dietrich. Hey, y'all. I think I spoke to everybody, so make sure when you get in here. Hey, Dr. Portia. Thanks for coming. 5 causes of headaches. So the first one is that I need somebody to take notes. Is seasonal allergies. Like, who here, hey Maggie, who here has been having problems with their sinuses? Anybody having sinus? Put yes, my sinuses are killing me. Yes, there's so much pollen on my car, Dr. Kre. Yes, that's why Dr. Kre sounds like this. I've been coughing all day. Hey, Nicole, coughing all day, snorting all day. If you're doing like this all day long and clearing your throat. Anybody having problems with their sinuses? Nobody's sinuses bothering them? Am I the only one? So my allergies have been killing me. They're killing Zoe. They're killing all of us in my house. So we are all on some kind of Zyrtec or Benadryl or nose spray or something. But seasonal allergies are one of the things that can cause a headache. Now, headaches can be low. Yes, Zyrtec, Allegra, etc. Everybody's on that. So yes, okay. So I see your comments coming in slow. So Tanya's bothering you, Miss Deborah's bothering you, Dietrich's bothering you. So I found that it depends on where you live, that your pollen count may not be that bad. So my parents were here last week for spring break for a couple of days. And my dad was like, oh my gosh, the pollen is horrible at your house. I'm like, the pollen is bad everywhere. Hey, Bernard. No. The pollen in Marion was not half as bad as it was here at our house. And we don't have a whole bunch of trees around us, so I'm really not sure where all this pollen is coming from. But I need to go grab me some honey or something, because, you know, bees pollinate, so they have all the good stuff in there. If you're not getting you some honey, if that Zyrtec isn't working, try some honey. So number 1, seasonal allergies. You can have, this is where your sinuses sit. here, and here. So if you're finding yourself having headaches in these two particular areas, feeling like your head is gonna explode, I have the telltale nose line. Yep, you got it then. So yes, so if you got all the pressure here and here, and it's piling, that's coating your car and coating your doorstep, like it is mine, then that could be a reason that you're having headaches. So number one is seasonal allergies. Number two, high blood pressure. Yes, high blood pressure can cause you to have a headache. Now, let's be very, very, very clear. High blood pressure is also known as a silent killer. A lot of people do not have any symptoms of high blood pressure. But if your pressure gets too high, you can have headaches, you can have chest pain, you can have dizziness. So it's kind of a blessing if you can relate your headache to being related to your blood pressure being high. So, hey, Sammy. So remember, high blood pressure is blood pressure at least more than 2 times. Hey, St. Tressa. Greater than 140 on the top, greater than 90 on the bottom. Yes, you could just eat a spoonful of honey, Nicole. Yep. So greater than 140 on the top, greater than 90 on the bottom. Hopefully it's honey that's grown in your region. That should help if you know somebody that's sells their honey in stores and at homemade. So try that. So number one, seasonal allergies can cause you to have headache here. High blood pressure can cause you to have, people come in, they have what's specific to them. Like, oh, I knew it was my headache. I knew it was my blood pressure because my head felt like just this swimming feeling. It was hurting, it felt swimming. There's a specific headache that goes along with high blood pressure. Everyone that actually feels that is different. So, Alexis, hey Alexis, yes, your head hurt too. So, number one, seasonal allergies. Number two, high blood pressure. Hey, Reverend, how you doing? Oh, hey, Derek, what's up? How you doing? You here tonight. We talking about headaches. Welcome, y'all. So, one, seasonal allergies, because pollen is everywhere. So, one secret that I found out that I do often, my husband does, and Zoe does too, is if your sinuses are bothering you, rinse them off, get the nasal saline flushes. You can just spray it up in your nose, let it run out, or spray it and then blow your nose. Helps to rinse your sinuses of all that pollen that you just been holding in your nose all day. So avoidance is key if you want to get rid of that allergies. So seasonal allergies, number one. Number two is high blood pressure. It can cause a distinctive headache. It's just very subtle, very distinct. They're like, oh my gosh, I felt that way. I had that pork. I had all that ham yesterday for Easter. And lo and behold, today I went to the doctor and my pressure is 170 over 100. Yes, all of that ham. Not good. Thank you for coming, y'all. So yes, number two is high blood pressure. Number three is diabetes. So what do you mean? Diabetes can cause you to have some headaches. If your sugar gets too high, you can have some headaches. That's what eating that good cake you had yesterday. Did you have pound cake? Anybody have pound cake yesterday? What kind of dessert y'all had yesterday? We made some cookies and brownies. Angelica made cookies and brownies. And so what did y'all make for dessert? And were you supposed to be having that dessert? Are you diabetic? Hey, Miss Player, how you doing? So number one, seasonal allergies. Number two, hypertension or high blood pressure. Your blood pressure can go up, cause you to have this swimming sensation. And if your blood sugar is too high, number three, blood sugar can be too high, causing you to not feel right, have headache. And you're like, oh my gosh, what's that? And you check your sugar and it's 375 and it's usually 100. That'll make you feel bad. If your blood sugar drops, you had homemade ice cream. How long did it take to make that? That sounds epic. Peanut butter pie, yes, that sounds good too. Y'all were eating good yesterday. Don't check your sugars today. Drink a lot of water. Cleanse yourself today. Cleanse from all that great Resurrection Sunday food. So, so I said, lemon cake, y'all eating good. So, blood sugar being too high can cause you to have those headaches. Blood sugar dropping too low. Too low is less than 70. It took about an hour. Blood sugar is less than 70 can also cause you to have headaches as well. So be mindful. Blood sugar going too high, blood sugar going too low can cause you to have these headaches. Seasonal allergies, high blood pressure, diabetes, or super changes in your blood sugars. And number 4, something so very serious is an aneurysm. Aneurysm is when you have like this bulging of a vessel, and it can throb. Your pressure goes up, and it's a little out pocket, and it's flimsy, and it throbs and throbs. Your pressure gets high, and it can get bigger and bigger. And then one day, out of the clear blue, you have these people that are like, yeah, my family member had an aneurysm. You know, they died from an aneurysm, or they had an aneurysm, and yes, they survived, you know, because we got them to the hospital in time, and then that blood vessel can rupture. So a person with an aneurysm can have headaches. So make sure that if you're like having these headaches every single day, and no rhyme or reason, you know, maybe you need to see a neurologist. Maybe if your headache, for me, is such a broad diagnosis, right? So when somebody says you got headache, these are the things I start thinking about. I'm like, let me check your blood pressure. How much salt you've been eating? How your sugar's been looking? So I start checking off all of these things on my differential list. And if I get to the bottom of my list, I'm like, oh my goodness, what do we do next? You may need to see a neurologist. If you have a family history of someone in your family having aneurysms, immediate family that is, brain aneurysms that is, you may need to have them to be checked out by a neurologist. Neurologist is a doctor that manages the brain. So seizures, strokes, Alzheimer's, those are the things that the neurologist manages. If you're in Birmingham and you're looking for a neurologist, check out Dr. D. Dr. D is a neurologist at the Dole's Clinic. Dr. Decante Jamay. So if you're looking for one, she's awesome. She is at the Dole's Clinic. Hey, Brittany Banks. So number 1, we said seasonal allergies. Number 2, high blood pressure. Number 3, diabetes. Number 4, aneurysms. And they're not like super common, but that's something that would be in the back of your mind if you're like, well, I've tried this. I've tried, you know, my sinus medicine. I've got my blood pressure under control. I'm not diabetic. You know, I've tried headache medicine. It's not a typical migraine. Because, of course, what's not on my list are the common things. Yes, migraine headaches can cause headaches, of course. And the neurologist actually can manage that as well. So the last thing, number 5 on my list, is a brain bleed. Brain bleed. Yes. So if you have, especially if you have an elderly family member. So elderly family member, and they actually go and they trip and fall and they hit their head. So I don't know about y'all, but I know the people in my life would not be like, yes, let me go and go to the hospital. A lot of it is, I feel fine, baby. I don't need to go anywhere. I don't need to go and get checked out. I'm okay. And I know you've heard about there's been several famous people that actually died from what's called you have subdural and an epidural bleed. So they're acting very normal. These are the layers, you know, to your head. So if the brain bleed is subdural, usually that's the older person. They tripped and fell. They hit their head on something. And it doesn't have to be bad. It doesn't have to be a hard. Because as you get older, your brain shrinks. So it has a lot of room to, if you jarred on this side, it can hit up against your head. This the front of your scalp. This the back of your scalp. The brain actually shrinks. So when you jar it, if you jar it hard enough, it can hit up against this side of your skull or that side of your skull. And they have vessels there. Those vessels bleed a little bit, can cause them to have subdural bleed. They have to get bored holes in their head, and they have to drain that blood off. But the one that's more serious is that epidural bleed. It is when you have a young person that was skiing. It was a famous person that died some years ago, and they had been out skiing and was fine one minute, hit their head the next. Didn't really go get any medical attention. A lot of times you don't, because you're young. You're like, man, there probably was nothing there. They can answer all your questions, like, what year is it, and who's the president, and where are you from, and what's your address. They're alert enough to do all of that, and then all of a sudden there's a very quick decline. So if you're having, they can sometimes say, man, I'm having one of the worst headaches of my life. If somebody starts to use those words in medical land, that's epic. You're like, okay, let's stop what we're doing right now, and we're gonna get you over here to get this CT scan of your head, MRI of your head. So those things where they say these thunderclap headaches or the worst headache of your life, those are very, 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 very serious. So when we hear that lingo, we say, we need to call Blue Cross. Get Blue Cross to whoever your insurance is. We'll call them and get them to approve your imaging, because we need to make sure that there isn't a big brain bleed. And when they have those epidural bleeds, they kind of push up against the brain, and they really they're very, 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 very serious. So I wanted you to know that there are some things that are just everyday wear and tear you that may be causing you to have high blood pressure. It could be your seasonal allergies. Make sure you're rinsing your nose out really, really good. Rinse your nose of all the pollen that you got going on. High blood pressure, if you have the diagnosis, or even if you don't, you may want to periodically check your blood pressure, because it could very well be high. 3, if you're diabetic and your sugar is super high, that could be a cause. Number 4, aneurysms. And number 5, brain bleeds, especially if it's post-falling or injury, car accidents. Those are all things that, you're looking at, you watching them, you're trying to make sure that they are not altered or different in any kind of way. So those are the 5 causes that I thought were important for you. Now, there are several other causes, things that can cause headaches. The 5 causes of headaches that you need to be mindful of. And the biggest, most prevalent one is, how do you rinse your nose out? So 2 ways. You can buy saline. You can go, and it's a saline nose spray. You put it in there and you can just blow it out. Or you can do my favorite way. You can get a bulb aspirator, like when the parents suck the snot out the baby nose, they suck it out. You can get you one of those. Get some warm salty water, as warm as you can stand it. Suck the warm water up with the aspirator. Put it in your nose, and let it immediately run out. Now, this is different than a neti pot. I can't tolerate a neti pot, because it goes all the way from one side to the other. This is literally just going up in your nose, you spraying it, and then holding your head and letting the water come out. And then, because the saline that you get over the counter, it's not warm in any way. I like the hood way, as I like to say. I like that way better, because it gives you the water as warm as you can stand it. And it helps to work here and kind of rinse those swollen areas out of in your nose, get the pollen off of there, and then you get some of that salty saline up into your sinuses, and it really helps to clean them out. At our house, we try not to use sinus medicine that much. We usually rinse our nose out a lot, and you'd be very, very, very surprised at how much gunk is in there that you just can't get by, because you got all this swelling here from smelling in that pollen over and over and over, or dust mites, or whatever it is that you're allergic to that you're smelling in all of the time. So, Derek, that's how you do it. Get you one of those bulb suction, the little greenish, bluish thing that the parents have for the kids. But instead of sucking stuff out of your nose, you're going to get that solo cup, put you some hot, salty water, warm as you can stand it. Make sure to try it out first. Yes. And then, aspirate it up, suck it up in there, put it in your nose, let it run out. Put it in your nose, let it run out. And you can do first thing in the morning, you can do your normal nose spray if you're on Flonase, which is over the counter now. If you're on Nasacort, you can do that. But when you get home, especially if you got an outside job, you definitely need to rinse those sinuses at the end of the day. So remember, you do not need antibiotics for sinuses. You don't need antibiotics for sinuses. You need to clean your nose out. You need some Zyrtec. You need some Allegra. You need some Claritin. You need Zizal. You need Flonase. Pick any of those. Clean your nose out. Allergies make you feel horrible. But yes, bulb, syringe. Yep, aspirator. They make you feel very, very, very bad. However, you don't need antibiotics. Remember, we talked about that before, y'all. Antibiotics need to be reserved for true infections. If you come to my office, I'm going to check your labs to make sure you actually need antibiotics, so that when it's time for you to have antibiotics, you sick as a dog in the hospital, they're not like, well, none of these, she's not responding to any of these antibiotics because she's been on a Z-Pack every week for, her life, or every season she getting antibiotics, she getting shots. So just be mindful of that. There's some things just have to take its course. If it's going on past 10 days, you may need to call somebody. You may need to let your doctor know. But give it some time. A lot of people are like, I got sick yesterday and I need my shots today. You're like, okay, we're just worsening your immune system if you're getting a steroid shot. And could be giving you antibiotics and you don't need them. If your labs come back normal, things just have to take its place. We live in a microwave generation where people don't want things to take its time. When you start back taking the patients, I don't know, Alexis. I'll let you guys know when I know. But my regular patients have been fussing. They can't get in. So I am, because I love my normal patients, I'm on sabbatical so that they can get in, get seen. And then new patients were complaining because the wait is so long. So I'm like, okay, we're going to hold off, do some good TLC on my current people, and I'll let you know when I'm back. But in the meantime, you can meet me here every Monday, unless otherwise specified, at 7 p.m. Central Standard Time. Clean your nose and use your allergy medicine. Yes, anybody have any questions? Any other questions? There was an awesome question. Remember, seasonal allergies, high blood pressure, diabetes, aneurysms, brain bleeds can all be things that cause you to have headaches. And if there are no other questions, you know who I am, guys. I'm Dr. Kre. I'm your board-certified family medicine physician, and I specialize in what's important to you through my awesome Facebook show, Dr. Kre and Me. Thank you guys for coming. Through my telemedicine, I thought you were one, Miss Deborah. Through my telemedicine visits, my concierge practice, and through just awesomely educating you guys. I let you guys know how to live healthier, happier lives. And remember, it's Dr. Kre. I'm healing healthcare and helping working wives to live balanced lives. I'm doing them both because I love you both for 2 different reasons. So remember, have a good week. I'll see you next week. Follow me if you're not already following me at Dr. Kre, DOCTORKRE on Facebook, and check out my new website. I'm not sure, a lot of you probably haven't seen it. www.drkre.com, spell doctor out, DOCTORKRE.com. Yes, Miss Harris, we'll keep you guys abreast to that. Love you. Have a good one.